Good evening and welcome to all of you who are here. Today, we're going to be talking on one diet does not fit all COVID patients. So welcome to this Nutrition Nectar program. And today I have a very, very special guest with me, Dr. Priyanka Rohatgi, who I have known, I think, ever since she started her nutrition and dietetics career in Bangalore. She was there earlier in Jaipur, but I think when she came to Bangalore, I met her first, and I was very impressed with her, her knowledge and her skills and everything. So I have known her for a very long time. I don't remember how many years that is, but then I've known her for a long time, and she continues to excel in the field of nutrition and dietetics. So I'm very happy to have Dr. Priyanka Rohatgi here today. Welcome to you, Priyanka.
Thank you so much, ma'am. This is like one of the topmost thing on my bucket list, and I'm happy to have it fulfilled in the pandemic.
Thank you. Thank you so much. If you have any questions, as usual, please type them in the chat box. I'm going to quickly share the disclaimer. One moment, please. Yeah. Are you able to see it on the screen?
Yes.
Okay. So the views expressed in this program are for information only. Please seek a physician's help if you have a medical problem, and please consult a qualified dietitian for personalized diet plans. Now to introduce Priyanka to all of you. Dr. Priyanka Rowatki is the Chief Clinical Dietitian and Head of Apollo Hospitals in Bangalore. She has been the President of Indian Dietetic Association Bangalore Chapter from 2011 to 2014 and an elected NEC member of the same association from 2015 to 2018. With a PhD in nutrition and management studies from XLRI, she is certified with SPEN, that is the European Society of Enteral and Parenteral Nutrition and Metabolism, LLL, that in oncology, renal, critical care, gastroenterology, body composition, perioperative nutrition, obesity, dyslipidemia, diabetes, and sports nutrition. That's a very long list of specializations. She has 18 plus years in clinical dietetics and research. I know for a fact that she's a great researcher. She's done a good amount of research in clinical dietetics. She has been the faculty for the online program Nutrition Quotient and IDA-initiated programs on weight management. She is on the advisory board of various MNCs. She has 8 gold medals to her credit. She's been awarded with international award from UK Emerald Group for the best scientific work for the year 2007. That's wonderful. She has a green belt in Six Sigma certification. She's a qualified trainer for 5S, which is a Japanese workplace management concept. She is on the editorial board of a few scientific publications. She has contributed many articles in both press and print. We frequently see her name in the print media. She has 50 research publications to her credit, both national and international publications in the scientific journals related to nutrition. So once again, Priyanka, it's so nice to have you here, and a very warm welcome to you.
Thank you, ma'am.
So I'm going to ask you the first question. You have been managing COVID patients, the diets for them since the pandemic hit India. How many COVID patient diets have you planned till now? Just an approximate figure will do.
I have some data on that. Can I share?
Yes, please. While Priyanka is sharing, I just want to say that, every time there would be some question or a query or a doubt regarding how to manage a COVID patient's diet, or we would always look at Priyanka and say, okay, Priyanka, what have you done in your hospital? How have you managed this? And she would always help us out with answers. Yes, Priyanka, please continue.
So we've had quite a few cases, and in Bangalore, actually, we started admitting the COVID patients from May onwards. And then there were some lean periods where we had very low occupancy for COVID patients. That was around November last year to maybe February this year. And then again, it peaked from March to till date. And So far, we've had around 3,246 patients who were admitted to the hospital. Now, each hospital also has certain COVID care centers where they put the stable cases who do not really require much of assistance. So they were close to 1,200 an odd number. We also had a lot of home isolated patients who were given home quarantine packages. So there were quite a few, and those were close to 5,000 and odd. We did have our staff getting infected. So we've categorized them as COVID warriors. These were few nurses, technicians, a few of our dietitians, physiotherapists. So they were around 310. And so totally, so far, we've had 10,436 patients that we were able to counsel and help out.
Wow, that's a pretty large number, I must say, for just one hospital. This is you're talking about just your
Only the
hospital, right?
Bannerghatta unit.
Yeah,
Only the
Bangalore.
Bannerghatta unit.
Okay, wow. All right. So, do all COVID patients require the same kind of diet plan, or does it vary from one to another?
We had the basic principles in place, which were of, there were quite a lot of guidelines given from Aspen, and all hospitals had prepared their own protocols as well. For some reason, I'm not able to change the slide. Yeah.
Yeah.
So these were the basic guidelines, but we had our own protocols made in place. To answer your question, it was very challenging to feed these patients, and we saw a lot of change from strain one, I mean, the first wave to the second wave. And last wave, when we had patients, there were people who wanted to eat more and more. So even two chapatis and a big bowl of rice was not sufficient for them. So we ended up a lot of overfeeding, a lot of frequency. And then we realized that, we're not doing any good. So then we started tapering the carbs and started introducing proteins for them. And that's when we saw a lot of positive change in them. However, this particular wave was very different because it was very difficult to feed the patients, and even the people with mild symptoms would just not want to eat. So they were very happy with their fluids. They almost always wanted something like a fruit juice to drink or maybe electrol to drink, and we know that's not sufficient. So this wave, and even till now, we are finding it very difficult because the taste which goes, in the last wave we saw that within a 3-4 days span we could see the taste coming back and they could appreciate eating. However, in this case, it is months together and weeks together that we see people do not have a sense of smell or a sense of taste, and they just don't want to eat. Their NIV usage, that is non-invasive ventilator, was higher. The usage of oxygen was higher, so they just didn't want to remove the mask and eat food. So I wouldn't say that one diet will fit all the patients, because there was a lot of other factors which played the role. Though we knew the principles of nutrition, but we just couldn't blanketly apply it to all the patients. The symptomatic representation was very different. In this particular wave, in the second wave, we saw people had bad gastroenteritis, bad vomiting, and the fever would be low grade in the first week and then suddenly peak up, and they just didn't want to eat. They were happy with the steroids. We were not very happy with the steroids and their sugars. And already in the home quarantined patients, we saw a lot of cocktail of medications which were used, and they were trying to do all possible things simultaneously. So this wave has been quite difficult in terms of feeding our patients. We had to do every possible thing, try and see how we could incorporate protein in their diet, try and see how regionally we could make a difference. If they were diabetic, some form of ragi mudde with some carrot goju prepared, because we couldn't give them a lot of salt and pickle, and a lot of dal, sambar, salads. So, it really differed from case to case, and we had to customize a lot of our diets, talking to all the patients on a daily basis.
Yeah, that's very interesting, Priyanka. So, that's a beautiful picture actually you put on this on the slide here. What you're showing is the various is it the various cuisines, or is it like based on the patient's requirements that you have all these different trays displayed?
On a daily basis, we have the South Indian menu, North Indian menu, which had veg, non-veg, both the options, and then there was a Jain variant, and we also had a Bengali variant because we do cater to a lot of Bengali patients. And we had to, between these menus, tweak each tray because we saw that some did not want to eat certain things and they were very particular. And these trays were disposable, so they never came back to the kitchen, so we couldn't really monitor the plate waste. We were totally dependent on what the nurses told us that patient could eat, could not eat, or whatever the patient would tell us. They were really breathless. So there were times we wanted to talk to them, they want to talk to us, but they were not able to convey what they wanted to say.
Right.
So we would talk to them every morning, speak to the attendants as well, and see how we could customize their requirement and give them a good variety.
Okay, that's excellent. And another question, taking off from what you said about the protein, is that you said in the first wave you gave, when you increase the protein and decrease the carbohydrate, you saw much better improvement in the patients. Did you find something similar in the second wave also, or did you straight away start off with a high protein?
We did straight away start off with the high protein,
Okay.
and we also added a lot of supplements this time, unlike the other time. And
Okay.
ICU patients, majority of them, because we saw that somewhere this whey protein was very, very supportive in the glycemic control. And then our team studied the whole thing and we found a lot of correlation between the two. So
Okay.
many of our patients are on 3 times ONS along with the diet.
Okay, wonderful. All right, going to the next question. Do you consult for COVID patients in the hospital where you work as well as online, or how does it work?
Okay, so mostly what happens is we all the COVID patients are consulted digitally, but we do visit the ICU if there is a requirement, and patients do get critical. Luckily, we've not had many TPN patients or patients who wanted had a requirement for parenteral nutrition. But sometimes, yes, some enteral feed patients who were just not able to tolerate, we've also visited the ICU occasionally. We were mostly dependent on the telephonic information and the digital information which was entered by the nurses. We still have the non-COVID ward, which is 20% right now of the total hospital beds. And we had our regular non-COVID ICUs working, few wards working, patients who were coming for dialysis regularly, patients who were coming for onco daycare. So these are our regular crowd patients, and there were times when we met them in the morning and the evening they tested positive. So times have been difficult for the entire team, but we all had certain protocols in place, like maintaining the social distance, which to some extent did not really, give them that personal touch, but we couldn't really help it. And we did not allow much of eating because it required removal of mask. So people who came for 4 hours of dialysis, they were given packed meals which they could eat on the way back home, so they don't
Okay.
really remove their mask. And we tried our maximum to optimize the turnaround of our onco ward, because some chemotherapies were 2 hours, some were 8 hours. So we tried to tweak around the time so that we could have minimal load in terms of the patients.
Okay, that's great. All right. Is there any formula that you follow when you come when it comes to the macronutrient breakup, carbs, protein, and fat? I know you did say that the protein increased and the carbs decreased, but do you have some kind of a ratio that you follow, or does it vary from one to another?
We had to tweak our menus. So what was initially, say, even up to 60% of carbohydrates had strictly gone back to 50-55% of carbohydrates. Deliberate effort to add fiber in each meal was made, unlike the earlier times. And protein was definitely added to much more what the recommendation is. We've even gone up to 25 and 30% of the total calories of proteins. Fats in certain cases were 20-25%, and a lot of these patients were very happy eating nuts. So
Okay.
they were given nuts in between. If I can just show how digitally we managed
Yes,
things.
please. Yes.
So this is typically how you would see we were all converted into a call center. So this is typically the ICU waiting lounge where you could go and access things if you had to video call the patient or talk to them. So there were cameras fitted and you could do that. Or if you did not want to access this room, you could have the DMR, that is the digital medical record, and then looking at all the parameters, you could then call up all the patients and the nurses would assist in video calling. There were lots and lots of things which were simultaneously managed. So you can see the first patient who's lying in the prone position. And you have to be very vigilant because he can desaturate if he really picks up his head and he doesn't maintain the proper prone position. And then there are the others who are trying to suction out the other patient who's again very sick. So there are lots and lots of these things which really brought a lot of stress, and people were not open to talking. Patients were not just open to talking. We all looked like zombies to them, totally mechanical, robotic. So, there were a lot of things which played on the emotional part of patients. We were titering all the infusion pumps for the enteral feed patients from outside. So we didn't want the
Okay.
pumps to get infected. So
But how
we were
did you
titering.
manage it from outside?
We would connect it then. So there is the chamber inside, and then the bag, the infusion pumps together are mapped on a stand, and for each patient, they were managed here. So we had to put some extension rods and do that.
I see. Which would
And
go
then,
into the ward, is it?
yes, into the
Okay.
ICUs.
Into the ICU. Yeah, sorry. Yeah.
Yeah.
Okay.
And there were a lot of multidisciplinary interactions, but these were all mostly virtual and digital. So we would not really get that satisfaction talking to our colleagues, which otherwise, when we do our multidisciplinary rounds, was happening. Now, coming back to your question on the distribution, I'm sorry to deviate.
No, that's all
So
right. It's very interesting.
we found that people who were on a limited carbohydrate diet, and especially the complex carbohydrates and fibers, helped us a lot, because we found that their gut was much better intact compared to people who were on frequent juices and simple carbohydrate. So that gave us a good glycemic control as well as a good gut health. So we could sustain with them without having any diarrheal episodes, or we didn't have to discontinue their eating or feeding just because they were very nauseous or they had diarrhea. And we had removed almost all forms of processed foods. We had lots of varieties of millets this time in our menu, which we've not had for the longest time ever in our menu. And these were few parameters which we were monitoring very closely, like apart from all the electrolytes, the C-reactive protein, the TNF alpha in some cases, IL-6 in some cases, D dimer. And the moment you see a negative trend coming in, you know that yes, this patient will be able to make it and is soon shifting out. There were lots of potassium fluctuations. There were lots of fluctuations with their anticoagulant drug. So platelet monitoring. This wave we saw a lot of lymphopenia, unlike the previous wave. So you would see that their lymphocyte counts were very low, and you knew that these patients can further deteriorate. So you wanted to pump in as much protein as you can, and that's here where we really looked into adding almost 3 portions of chicken in every meal or eggs in every meal. So those were extra cost interventions, but the hospital was agreeable to do that, and we could really deliver very good proteins apart from the ONS. This was what we felt when we gave the whey protein supplements. We have only used whey protein supplements of different companies, and we felt that this was very insulinotropic. So it could really manage your glycemic index if you timed it according to the snack time very well. And we felt that the sugars could be beautifully managed. This time of the wave, we had lots of steroids being used, so sugar fluctuations were high, and with the whey protein, we were able to manage it very well. We didn't require much insulin intervention.
Okay. Just a quick question. Offhand, if you can tell approximately how much of whey protein you were able to give the patients,
See, we would use
just
around
roughly.
2 to 3 scoops of the whey protein isolate. And if they were overweight and obese, we would choose only a high protein formula, which is just protein and not high calories. And only if they were
Okay.
underweight and young, we would use a high calorie, high protein formula.
I see. Okay.
So that was, yeah.
Yeah, it's good to know that whey protein plays such a big role, at least from what you have seen amongst your patients. The whey protein has played a big role in maintaining
We actually
the
looked back and found a lot
glycemic
of studies. There were lots and
or
lots of
glycemic
studies.
levels, is it?
Yes, glycemic levels, because it reduces the insulin requirement, and
Mm.
it will keep your sugar sustained for a very long time. So you have very good postprandial control. You have delayed gastric emptying. So the sugars are sort of sustained,
Mm.
and their appetite is managed well. this time we had a challenge of feeding people because they were not really keen to eat. So we don't mind giving smaller portions of carbohydrate, but giving the ONS in a higher volume. So
Okay.
this would roughly be 100 to 150 ml of the supplement that was given 2 to 3 times a day.
Okay. Quickly, just to expand the acronym ON for those of you who are not
Sorry,
dietitians in the audience, ONS is oral nutrition supplements.
I'm sorry.
All right, that's okay. That's great. All right. So coming to the micronutrients, what kind of micronutrients do you emphasize for the COVID patients?
See, omega 3 was something which was really, really helpful, and we have used the IV omega 3 as well as oral omega 3 in the patients. That helped us in reducing the viral replication, but of course, with the antiviral medication. And patients have been taking vitamin A, D, C, and B12. Additionally, we had just added B6 and vitamin E to their diet. And most of these B complex concoctions are rich in your folate. Iron was used in some of the cases, not all, where we found lymphopenia setting in, or the hemoglobin was dropping, or we were suspecting some GI or internal bleed because of the anticoagulant use that we were putting up to. So, predominantly, yes, this. Zinc off late has been tapered because there are cases of mucormycosis, and people are suspecting that zinc can be a correlatory factor. So we were giving 40 to 50 milligrams also. Now we've come down to 10.
10, is it? Okay. All right. But has it made any difference, coming from 40 to 50, if you've drastically brought it down to 10? Have you seen any difference?
We really don't know because in-house when we started having mucormycosis from our ICU patients, that's when we were quite. And then a lot of our discharged patients came back and they developed the black fungus. So and there were patients who were non-diabetic but on steroids. There were patients who never used oxygen. So, we just couldn't correlate it only with the oxygen and the unhygienic water which was used. So there were many factors. And then what our ENT team and Ophthal team felt was that we all have mucor present in our body. So there are certain factors which can aggravate, and definitely a low immune response to the body will let it grow. And zinc was found in few studies. It's still under debate.
Yeah, right.
So, a little underplay is always better than, getting a mucor and trying to get the treatment for that.
Yeah, so true. All right. So
And
are
why
more,
we came from 40 to 10, I think that
yeah,
was your question.
yeah, that's right.
So 40 to 50 is basically what you get in an exclusive zinc supplement. Like you have your zinconium or you have Bicosule Z. Now, when you move into a multivitamin, something like Zincovit, that'll have 10 milligrams only. So we didn't want to
Okay.
give 2 tablets, or we didn't want to give exclusive zinc preparation.
Okay. All right. My next question is about, of course, about the supplements. Are most patients' nutritional needs met through regular diets, or do they need supplements? You've kind of answered that already, but if you want to say something more, please feel free.
So patients in this way were definitely not meeting up because the food would go to them, it will be lying, they would half finish it. We have something called a food and fluid chart, whereby the nurse just keys in that he's eaten half, 1/4, or 3/4, and with that we calculate. So we found that most of the plates were discarded when they were half or 3/4 consumed only. And a couple of times egg, chicken, and the high protein sources were left. So we did, for all the ICU patients, at least 75% of them, we have used oral nutritional supplements 3 times a day. And once they shift to the ward and we are confident and they are more confident talking to us, we can talk to them 2 to 3 times in a day. That's when we talk to them and taper it down. They themselves felt much, much better in their energy levels when they were on a supplement. In the wards, however, only the cases who had moderate, symptoms and they were oxygen dependent, 40% of them is what we would have given the supplement.
Okay, that's pretty good. So I'm sure there would be a difference between the hospitalized patients and from those who are quarantined at home, right? So how do you advise, these two categories?
At home, the management is much, much better because you get nice hot food as per your choice, as per your palatability. And the patient is also more comfortable. But things were definitely not the same in the hospital because we used disposable trays and that could not retain the temperature for very long. The food is packed from the kitchen and then given, and then our staff who's there in those wards with the PPE would go and carry it. So we did not find, the temperatures very satisfying, and that catered to a dissatisfied palatability also. Patients were very very anxious. So constant, when you call them, you're asking them something about, did you eat better? They said, I just want to die, I just want to go home, can you just convey it to the doctor, please discharge me, I don't want to be here. They were very very anxious. And I can understand. See, when you're in a ward constantly with zombies around you in the PPE, nobody wants to come close to you. People are talking at a distance, you're just having virtual connect. It plays a lot of role. People were sleepless, they had very high sugars at some point of time, they didn't want to eat, blood pressures were fluctuating, they had some different bowels, some had vomiting, loose stool, some had constipation, and all of it, gut brain correlation. If we go ahead, we had to really play around with their hydrations, we had to understand how much of IV is planned for today, what is their fluid intake, which was difficult to get a daily count on, but we had to constantly talk to them. So what we realized was that if you tackle the whole problem emotionally for the admitted patients, half of the war is won. So we came up with a lot of innovative things, and that really helped us treat our patients well. We had something called the tender loving care moments, and floor wise, we had each ward and we did certain competitions. So we had the nurses in PPE dancing and trying to do certain things. We celebrated Baisakhi, we celebrated Holi, we celebrated Eid. And if we got to know that they had their birthdays or anniversaries, we tried to organize some cake cutting. We had virtual Sunday brunch with the family. So whatever the patient's favorite brunch options were asked from the family, offered. If they wanted to pack it in a disposable meal, we did allow. Unlike the
Okay.
other rules where we never allowed food from home, these are times when we were quite liberal with all this. And they would connect with the family and enjoy a nice virtual Sunday brunch together. We did it even for Ugadi and certain festivals. And if they really ate well, we had food as a reward mechanism. We have this golden touch, which is like praying together. So if they were shifted for any procedure or a CT scan or an X-ray, we would all pray together in the ward, and then they were shifted out. We did certain hobbies, if they had any painting, drawing, so we organized small kits for them. I'll just show you some pictures of those.
Yeah, that's wonderful. I think it's a wonderful way of connecting with patients and keeping them. What should I say? Keeping them not motivated, but keeping them positive.
It plays a
You know.
lot of role, and you
Yeah,
would
I'm
see that
sure.
their food intake definitely made a difference after. So this is a family which had not spoken or seen their mother for almost a week, and they were all spread in different time zones. So it made a lot of impact where the nurse facilitated the virtual setup, and it was beautiful, and we could see the smiles, the satisfaction, and it was very very satisfying and gratifying. And then there was this highly educated gentleman from Indian Institute of Science, and we just couldn't engage him in any conversation because he was on a total different level of education. And so he had specific requirements, and because of the lockdown we couldn't really go out and pick up books. So all of us who have a lot of extra books and we really don't know, we've read them, we don't want to throw them, but we really don't know where to donate. So all of us pulled in all those books together, and we were able to set up a nice small library
Oh,
which is now
nice.
being used by all our patients.
How lovely.
Then this is a wedding which was cancelled 3 times, and unfortunately last, when the date was finalized, because the couple had to join back and things like that. So the father is in the ward, and if we can see that he's blessing the couple while the wedding
Oh,
is happening
yeah. Through the phone, is it?
through the phone. Yeah. So we can see his
Okay.
hands raised. He's trying to bless the son
Oh,
for his wedding.
how sweet is that?
These are small
Yeah.
things, but I think
Yeah.
they
No, it
go down
means
a
a
long
lot, I
way.
think. They look small, but then I'm sure it has a lot of depth and meaning for the people who are there.
And it's not additional cost at all. Just you the whole ward is Wi-Fi connected, so you're just using the
Mhm.
technology to feel them connected, to feel that yes, we care for you. So
Okay.
And then
Beautiful, I think.
there are these birthday celebrations. So we had some dance and cake cutting and all that organized. Then we had some Eid celebration, both COVID and non-COVID wards. So we had a nice fruit basket prepared for all of them, and this was gifted to them. Then we had a young mother who was missing her post-delivered son, and the elder son prepared a nice "Get Well Soon" card for her.
How
He
nice.
framed it for her, and she was very thrilled. So these are real lifetime memories, which
Yeah.
take us a very long way.
Yeah, I'm sure. And also helps to heal the people better and faster, I think. I think this is a beautiful way that all of you have come together to, you know, uh, make people feel better and probably get them to go home faster too. All right. Coming to the next question, what is the kind of dietary advice you give patients that are being discharged from the hospital? Because after going through all of this, they probably would have a lot of questions about what to eat, and especially you said second wave, people are not eating very well. So when they going home, they probably would have questions about what to eat and how to prevent this from happening again.
Okay. So what
So
we had a constant touch with all our patients while they are admitted with us, and the nurse would give us a green signal that they are for discharge today. In fact, they would come forward and say that I'm going home today and I'm going to be with my family. So all those points which were captured during their diet planning in the admission time is all customized, and diet charts are made. These were all e-diet charts which were attached to their discharge summary and emailed to them. We had minimal exchange of hard copies because not many people wanted to carry the paper from the hospital home. And then we have our service excellence team, which makes post discharge calls after a week and then a fortnight later, and thereafter, they're on their own. So then we try to, gather if there are any issues, and then there is an alert given to the department that this patient had some issues with the diet or is not eating well, or the family is concerned, or still there is, some infection, and whatever be the concern, then we call them, we set up a call with them, and then we try and help them out.
okay, that's very nice. Is any special attention given to the hygiene and handling of foods in the dietary kitchen in your hospital, especially the kitchen that handles? I don't know if you have a separate kitchen for the COVID patients, another for non-COVID, but is there any special attention given in the dietary kitchen which handles COVID patients, like maybe disinfecting the groceries and maybe sterilizing the perishables or something like that? Do you follow any such thing?
Not, I mean, there are protocols which are there. So what we generally do is surface disinfectant for everything is being used. And if there are any products which are given as samples from the company, like, a lot of companies came forward, they gave their ORS liquid tetra packs as samples to give it to all COVID patients and the warriors. And there were high protein supplements which came in from a lot of companies. So those were actually kept there for at least a period of 48 hours, and then surface disinfectant was used. All our groceries procured by the hospital and kept in the store and is left untouched for at least 3 to 4 days. And thereafter, a weekly issue is made to the kitchen. All the staff who's posted in the COVID ward have a separate accommodation. So I know this is, a very negative impact on people who are working, but most of our doctors, nurses, and F&B and housekeeping staff, we have an attached hotel. They would go back there and finish their 14 days. They would have a 14-day posting. So for those 14 days, they would be staying separate. And then, they would come back, and after a test, they would join back to the regular non-COVID activity. And there was a
Okay.
special allowance for them. So across the group, they were given an additional payment. So they were happy to do these duties.
Oh, yes, I'm sure. So, was there somebody monitoring? You said there would be a 3 day, gap between procurement of groceries and then sending it to the kitchen. So, was there a person one person monitoring, this gap, the 3 or 4 day gap between the procurement and the supply to the kitchen?
Yes, the materials department has these challans, the
Okay.
logs maintained, and that was entered. And if any one of us had to travel back to our natives for, a family member not being well, or in this period, two of my staff members got married. So, people, when they came back after the wedding or whatever, there was a 3 days quarantine period, and then they were all tested with the RT-PCR. Screening is done on a daily basis, and you could just join after the RT-PCR report is negative, because we all work in smaller places, and dietetics department itself is not a very huge room, so we all sit together and we are constantly on calls. We do wear masks, but then there are chances of cross infecting each other.
Yeah, right. Okay, I think people are handling it beautifully. Is the meal service different for COVID inpatients versus the other patients in the hospital? This also, I think you kind of answered, but if you have anything to add.
Our cost for COVID ward management has been really high because number one, the disposable cost. Every
Yeah.
day, the tray itself is 15 rupees a tray. The cutlery is again disposable, and all of it is just an additional cost which has come up for all the 3 meals every day. Then the menu has a lot of non-veg and protein, which is not the case with all the non-COVID patients, only if the need be. So our costs are definitely high, and we could not pass on the same cost to all the patients, because we do cater to such category of patients who are coming from the BBMP ward. You can't really charge them anything additional.
Right.
And then you had the private category patients who were already paying quite a bit. So from that, the hospital agreed to pay the F&B, whatever additional a little bit. But I'm sure we did not make real profit there. F&B manager is always complaining when you have extra portions added.
Yeah. But it's nice of the hospital to take care of these extra expenses, I think. All right. So with that, I come to the end of my list of questions. Would you like to add anything else, Priyanka, before we move to the viewers' questions here?
Yes, ma'am. So there are few things. Um, yeah, this is about the cost and portion size and
Yeah.
nutrition density. There were few things which is typically a non-nutrition advice, but you would encounter with most of your patients. Number one, when you talk to them, you can see that they're really making an effort to talk. They're really panting and their energy levels are very, very low. So, you'll have to be very slow. If you can be in the local dialect, it really helps. They had difficulty in breathing, so constant steam and constant breathing exercises, we do that. We do a yoga session inside the COVID ward, each of the wards, in the morning for all the patients, and then they can continue those exercises. Our physiotherapist goes and attends to all the patients for chest physio. There's a lot of chest congestion, and people correlate a lot of food with congestion, like banana, milk, curd. And that you have to use them in the diet, because you can't really make a lot of compromise on the food habits. People do not want to have a lot of vitamin C, because they think anything sour can add up to the infection or increase their cough or soreness in the throat. Poor appetite, constant headaches. So, you may have to supply some infused water at warm temperatures, which helps them, which is not a major cost, but it is just trying to give them an extra attention, which really gives them the relief from the pain. Anxiety was something all of us have gone through as COVID warriors and as, healthcare workers attending to these patients. So, definitely that has to be attended to. Then lack of sleep. So our first call starts with, so how was your sleep? Did you sleep well? Are you feeling fresh? Unlike what we would otherwise talk to patients when we physically
Yeah.
meet them, and trying to tell them, yes, your daughter had called up, she was very happy to see that yesterday you ate this, or those kind of things really helped us. We deliberately removed all the news channels from the TVs in the wards, because we didn't
Oh,
want. So we had only pipe music, some religious serials going on. There were no news channels in the wards, because it was so much of negative impact on all of us. So that was a call taken from the hospital, that let's not have any more bad news going to them. And at any point of time, any one of us had any of these issues. I'm sure all of us as hospital staff have felt that when everybody is in the lockdown, why do I have to drive down to work and go? And a lot of our team members also feel the same. You can see that they are not interested in food. They're not interested. There's a constant fear that, every day, am I carrying the infection home? Is it worth being a healthcare worker at this salary? Constantly these kind of questions came up. So handhold each other. These are difficult times, but they are not there forever. So try and engage in the best possible way you can keep yourself active. This is from the nursing hostel. and they do it every single day. These are young girls who are very vulnerable to emotional, breakdown. So all of us have to ensure that, we hold each other together. So we have these constant motivational speeches, recorded videos from all of us, just to tell all of us that these times are difficult, but they are not forever.
Right.
And these are some fond farewells of our patients who get discharged. And we have a memory wall on which we try and e-wall on which we show them that, you've been a member of our family at some point of time.
How nice. That's lovely. Okay, so wonderful. Beyond going beyond nutrition, I think that's really wonderful because there's so much one can do as a healthcare professional. Not just looking at the diet. I think there's so much more one can do, and I think you've shown how beautifully you can actually help the patients to overcome problems and motivate them to feel better and then go home, recover faster, and all of that. So this was wonderful. Thank you so much, Priyanka. And we have a lot of people writing in the chat. I'm just going to quickly go through everything. Sarupa Kakani, she was the first person to write and say a big hi to both of you. Thank you so much, Sarupa, for being here. Prashansa Jain says, hello, ma'am. I think that's to you. Kanika Verma, how lovely. You must be so proud and happy to have your student, make such a beautiful presentation here. So thank you, Kanika, for joining. She says, hello, Sheela, ma'am, and Priyanka. Vinny Joglekar, hi, thank you for joining. Vinita Bansal, she says, good evening, thank you for being here. Sandhya Singh, of course, you wouldn't want to miss your colleagues' beautiful presentation. Thank you so much for joining, Sandhya.
I owe a lot of the work to Sandhya and my entire team.
Oh, that's so nice. Yeah, I'm sure you do. You have a very great team, Priyanka. Vinita has a question. Can we give music therapy in wards or ICUs to decrease stress level of patients?
We did think of it, but we were not able to get those headphones. And if the family was wanting to get it, it was additional cost. And if we really bought the low quality ones, we were not able to plug it in and get a good output.
Okay.
So this is a very good idea.
Yeah, it is. It is. And I think it's being used in some of the, probably not in COVID, but for other patients.
We use it in the OT, in the operation theater, when the patients are getting operated. So there's a music which is plugged in.
Yeah, right. All right. Neha Dua says, hello, Sheela. Hello, Neha. Hello to you. She says, hello, Priyanka D. Probably
She's a very bright girl from Jaipur.
Oh, how nice. Okay, so you have the Jaipur crowd also here. How nice. Vinny Jogleka has a question. How to manage high sugar levels like 380 postprandial, which was increased only by giving steroid when patient is discharged?
We had these encounters. We even went up to 500 sugars. And if you can do quite a bit with the food. We had replaced the simple rice with the unrefined muesli, unrefined millets, and increase the protein part of it. We would make khichdi with 3/4 dal and 1/4 of the cereal part of it without the patient realizing, and nicely mash it and give it to them. And sometimes, yes, we've used insulin also in non-diabetic patients to bring down the sugars.
Okay, all right. Beena Naik has a question. Thank you for joining, Beena. How long post-discharge is this macronutrient composition recommended?
We so far have had patients who are taking it for 2-3 months also, because they don't find their energy levels to be back to absolutely normal. But it's very, very individual. There are few people who don't believe in medicine, so they wish to eat the natural food and they would discontinue maybe 1 week after discharge. So it's very, very individual. I would recommend, I started last March and I still continue. So I have a very strong belief in micronutrients. And
all right. Veena Upadhyay, thank you for joining in. Susan Verghese has a question. Are there any particular foods we should avoid during the pandemic, and will taking probiotic supplements help in any way? Great question.
Probiotics definitely probiotics have helped. We were using the powdered form of probiotic for the simple reason they were very easy to administer. And when we tried giving Yakult or anything which required the cold chain, it was difficult because people had that apprehension of having anything cold. Yes, this definitely helps. So probiotics is something which is very promising. And if you're able to sustain a good gut health throughout, half your battle is won, because you don't lose any day of not feeding the patient. The first part of the question was
Any particular foods we should avoid during the pandemic?
we tried to
Probably as a
avoid
preventative measure.
we tried to avoid as much junk as possible. There were requests for ice creams, chocolates, gulab jamuns. So we had to tell them that, for the simple reason, if you tell them that when you take anything which is very high in sugar for the next half an hour, all the other micronutrients will not be absorbed. So they don't really want to take that chance then. And they say, okay, let me recover, go home, and then I will eat. We've, however, given a fruit custard sometimes.
Okay.
We've given some payasam sometimes, but not a lot of the high sugar containing foods.
Okay, that's interesting. So what about the fat? I mean, you wouldn't probably give oily foods and high fat foods also, right? Just to answer again Susan's question.
We haven't given it as a blanket rule to anybody, but yes, we did have a 82-year-old day before yesterday who did not want to eat anything and wanted to have pakoras. So then we had to give him some paneer pakoras, and then he got back to started eating the normal foods.
Okay, all right. Yeah, well, at least you tried the paneer part of it there, which like, gave him some protein, and the pakoras was besan, I suppose, so some protein from there. Okay, great. Now, Kanika Verma, obviously she's so proud of you, Priyanka. She says it was great to listen to a bright girl. That's a lovely compliment. Thank you so much, Kanika. All right. Pallavi Singh says it was a nice session. Thank you so much. Vinita says thank you. Usha Dharmanan says new perspectives and lovely presentation. The credit goes to you, Priyanka. Thank you so much for that. Sandhya Singh says it was a great presentation, Priyanka. When we see it on the PowerPoint, it looks so good and motivates us to do more. That's excellent. That's such a lovely compliment. Very practical session. Thank you for organizing. Okay, well, Sandhya, don't thank me. I think we should be thanking the guests who come in every time and share their beautiful knowledge with all the viewers. So the entire credit goes to every guest of mine who has come on Nutrition Nectar platform and been so generous and so kind by giving their time and sharing the knowledge. All right, Anjana Nair. Hi, Priyanka. What do you think of quinoa?
We haven't used much of it because it's a cost driven thing. We definitely could not afford 400 rupees worth quinoa portion. So we haven't used it in the hospital patients. In the home quarantined diet, some people were using and we encouraged that.
Okay, that's nice. I hope that answered Anjana's question. Thank you for joining, Anjana. So nice to see you here. All right. Neha Dua has a question. Priyanka Di, what is your take on consumption of wheat chapati and milk during COVID and post-COVID?
It's a very common preparation in North. They make the
Okay.
fulkas, and the warm fulkas are soaked into hot milk, and people feel that they're eating a healthy meal, doodh roti.
Okay.
So, but this wouldn't give you much fiber. Yes, you're getting protein and you're getting whole grains, but you won't get much of the. So once in a day, it's okay for some time, and but you'll have to get back to your fiber and good intake. So I would suggest if you make a nice vegetable khichdi with dahi added to it, that would be a better preparation. That's again very North Indian, and people would like to eat it.
Okay, so when you say chapati and milk, do you actually dip the chapati pieces in milk and then eat it, or
Yes,
is it
it's
just
like a
eaten?
pulka. So it's a nice hot pulka which is prepared. You cut it into small pieces, put it in nice hot milk. So it
Oh, all
just
the
sort of
pieces. Okay, and drink it, is it?
it's sort of chewable, semi-solid
Yeah,
it
yeah,
becomes.
yeah. Okay, interesting. All right. Bharani Dharan says, hello, Sheela and Priyanka. Excellent session. Thanks for arranging this. Okay, thank you very much. Please give your opinion on antiviral foods. Oh, Lalita Priya. Okay. Sorry, I didn't recognize that name, Lalita. Lalita Priya, that was her question. Your opinion on antiviral foods.
We've used a lot of these in our menu. So we have something called haldi milk, or the most commonly called as turmeric latte, which goes to all our patients at night as a bedtime milk. So we add a little bit of pepper into it. There's haldi, there's some amount of jaggery, and a handful of nuts if they want to add eat with that. And haldi is not something which agrees with everybody's system, especially if you have diarrhea. So there are times when we have limited the haldi milk for them and replaced it with oral nutritional supplement in water, but very few cases. Majority of our cases do get haldi milk, which is antiviral. We add a lot of haldi and pepper in our menu, the black pepper in the fresh ground form. Pongal is another preparation which is rich with a lot of antiviral properties. So we use, try and have it in the menu at least 2 to 3 times in a week, and people do like it. We do a nice millets and oats khichdi where we try to include a lot of these antiviral foods. So that helps.
So basically, you're talking about the spices, right? The which are
Spices,
added,
foods which
black
are
pepper and
anti-inflammatory. Yeah,
yeah,
spices,
right.
turmeric. Yeah.
Yeah. So this haldi doodh that you're talking about, is that given at night just before when they go to bed, or is it kind of given with dinner?
No, so we have the dinner which is served around 7:38, which
Mm.
many people find it little early. But that is the time we want them to eat because we want
Right.
them to sleep by 9:30, 10 max. And around 9:30, we give them the haldi milk. So they
Okay.
just have their mouth rinse and brushing, and then they go off to sleep.
I see. Okay. Interesting. Kanika says, is it a good time to educate the family after the patient recovers? Yeah, that's a very valid question.
We do that, and Sandhya would, break her head every single day because she has been handling the COVID ICU for the longest time that we've been working. So she ends up calling the patient, she ends up calling the attendant, and then we receive the call from the next attendant who's somewhere in Bombay or Goa or somewhere else. And then they want to have the complete update. And with her sweet and nice tone, when she starts and she's trying to help, they want to know the D dimer levels, they want to know what was the initial level, when will the patient be tested for the antibodies, when will they come out of COVID, and lots of things. So, yes, this goes hand in hand. We've been doing it throughout.
Okay, okay. So, yeah, I guess that answers Kanika's question. Anjana says, excellent presentation. So, thank you, Priyanka, for that. And Swarupa says, very informative session as always by Priyanka. So, once again, thank you, Priyanka, for that. Looks like we don't have any more. Okay, one more question came in. Any recommendations for traditional KADA as a preventive measure? This is again from Lalita Priya.
We haven't been using much of it because when you make it in a real concentrated form, like we have a Chennai preparation called Kulanir, and we found people were having gastritis. So we would prefer an infused herb into the water rather than using an overboiled or overbrewed kadha preparation. And the season has really changed. It's really hot in the afternoon, so we do not really give them a thick concoction of any of these.
Does anyone ask for it? Because everybody is reading about KADA in the media. So, any of your patients have asked for it?
They have asked for that Pulanir, which comes from Chennai.
What is pulinir? I don't know what that is.
It's a powdered form of thing which you have to boil till it becomes one fourth in the consistency, and it's really bitter. But
I
there
see.
have been people who've been asking for it. So we tell them that it's if you want to try, we can facilitate, but it's not going to really help you much, but add to your gastritis. So you want to try, we can send it. But it's
I
not a
see.
very common practice that we encourage.
Okay. All right. So, yes, I don't see any more questions in the chat box. So, I guess we've come to the end of the session now. Priyanka, thank you so much once again. It was really very, very informative, and your slides were beautiful. And I really like the way you have, gone. All of you have gone beyond nutrition and done a lot more for the patients. And I think that will really help the patients a lot. And thank you so much for sharing your knowledge and for spending time. I know you're very busy, but in spite of it, you've made time for this. Thank you so much for being here.
It was an
And
absolute
many,
pleasure.
thank you. And many, many thanks to the viewers for being here as well. I hope to see you all at the next Nectar session. Stay tuned. We'll be back with more. Thank you very much. Bye bye and have a great weekend.
Thank
Bye,
you. Thank you,
Priyanka.
ma'am. Bye bye.
Thank you. Bye bye. Take care and stay safe, all of you.